Now let's talk about why metabolic health is so important and where you should start to learn more. Here to break it down for us is Dr. Heather Saran with Bright Endocrinology. Thank you for joining us.
Thank you for having me today.
Okay, so not everyone knows what an endocrinologist is. Can you share what conditions you specialize in?
Endocrinology translates to the field of hormones, but most of what an endocrinologist does is treating thyroid conditions as well as diabetes. I go further and I focus on preventative care and really making sure people are living a long, healthy life.
Okay, that's very important, to live a long, healthy life. So your medical awards alone speak to what a great endocrinologist you are. So how did you become passionate about the field that you're in?
I grew up being a dancer, and I learned pretty early on how quickly nutrition and your metabolism plays a role in your performance and your vitality. And I've been able to translate that into the field of medicine.
Okay, and so your practice is unique in that it's direct care. It's a direct care practice, right? Tell us more about that.
Correct. So direct care operates outside the insurance system. With that, there's less barriers. Doctors are more accessible. My patients have my phone number, they have my email, and they can contact me at any time. This, although it may sound like it has higher out-of-pocket costs, it's actually less. There's no surprise bills at the end of the day, and people have access to me. They're not having to go to urgent care or waiting out the emergency room, and it can take months to get an appointment, and I make sure that my patients always have access to me.
Which is very important, because if someone's in pain and they're not feeling well, they can't wait months to see a doctor.
Exactly.
Okay, so what challenges did you face in the traditional healthcare setting, and how have you been able to overcome them with your direct care model?
With traditional healthcare, there are all these barriers. You know, insurance companies get to dictate how long the appointments are. And with those limitations, I'm able to get people in immediately. I'm able to address their problems, and we're able to really focus on getting them to live the best life.
Okay, so let me ask you this. What type of people will get the full benefit from your practice?
My ideal patient is someone who's really involved in their health care, someone who's engaging. And since I offer longer appointments than traditional doctors, they're able to ask questions, and we're able to get at the root source, not just throwing medication at people.
Yeah, so they really feel comfortable with you and feel like they're really learning about their issue.
Exactly. People feel the difference as soon as they walk into my office. You know, it's bright, it's inviting, it's not, you know, a sterile hospital.
That's good, because I know a lot of people are hesitant to go to their doctor and they keep canceling appointments or they push it off, and then that means it could cause some real harm to them later.
Exactly.
Okay.
So getting people in is the best thing you can do.
All right, so for people who are still new to direct care model there, what do they need to know about it and how it works?
So without insurance limitations, people get the longer visits, they get in quicker. If people have HSA, FSA funds, they can actually apply those and use those pre-tax dollars. And if some people have out-of-network coverage, they can actually ask their insurance company to pay them back.
Oh, really?
And like I said, no surprise bills.
Okay, so how could this actually make healthcare more affordable? I know you just listed off a few things.
Yeah, so with preventative medicine, we can keep people from getting sick, keep people out of the hospital, keep them from needing medicine, and that overall lowers costs.
All right, and if you want to learn more, go ahead and visit brightendocrinology.com or call the number there on your screen.